We had the symposium on cytomegalovirus, which is CMV. It's one of the common viruses that we see after transplant. Our patient can get reactivation because they've been exposed to it previously, and it can cause a grave outcomes unless we do something about it. So in my talk, actually, what we did, what I went over is immune monitoring to see if I can predict with a specific test called the CMV ELISpot. It's a T-spot assay where looking at T-cell response for CMV. And if it is there, then it will provide protection against CMV reactivation. We did a multi-institutional trial to try to validate the data, where we found the one who had a good CMV-specific T-cell responses on the ELISpot assay, they're the one who were protected from CMV reactivation. So it's kind of showing the value of this kind of testing to help us manage these patients with this infection, because sometimes we overtreat when we don't have to, especially if the immune system will take care of the infection and will control it. The interesting study that we did as well, we looked at patients who had low level of CMV in the blood or CMV reactivation. And usually in the real life, we overtreat this patient. Some patients may progress, so that's why we need to treat, but some patients may not. And they were not a good, valid test to know who, or to predict who will progress. So we did the same thing. We follow a patient, around 55 patients over time who had this low level of reactivation. And based on the T-spot test assay, we found that if they had good response on the T-cell assay, they were protected from progression and they didn't need to be treated. And the one who had low responses, some of them progressed and they needed to be treated at certain cutoff, and they did well. So I think with this test, the utility of it is it can help us to determine if these patients can withhold treatment and keep an eye on, because they're going to have self-limited infection, versus patient with low T-cell responses on the T-spot CMV assay, and they need to be treated maybe early on to prevent also grave outcome. So this is another way of showing the utility or the value of this assay as well. Help us as a whole as one part of the puzzle to manage better our patient with CMV infections or at risk for CMV.